ZombieTech. Welcome to ZombieTech, a forum for engineers, scientists, and inventors to ponder on the technologies needed to survive the inevitable zombie apocalypse.
She's Eddie.
He's Whisker.
And who do we have this week?
This week we have Tom of Medical State of Mind, of Tumblr notoriety. Hi, Tom.
Hello.
So, you started this blog in...
Wait,
was
did
it July?
Like a Canadian accent there?
You do.
They have doctors up there?
I know, eh?
Huh. Because I heard
true.
some
We
stuff
don't all
about
just live in
Canadians
igloos.
and doctors.
What about him?
Well, like they don't really have real ones up there or something. I don't know.
That's not very nice.
I was watching on
Whisker.
TV.
That's not very nice.
I'm,
What are
of
you
course,
trying to pull here?
absolutely kidding. I happen to like Canadian doctors because when you go to them, they're not like, give me your house.
True. Not yet, anyway.
Yeah.
Not yet. That's
Yeah.
right.
That's right.
It's coming.
Oh, you guys are still working on it.
Yeah, we're working on it. We're a little bit slow. We just follow our American friends down on the south side of the border.
Now, obviously, this is a politics sort of go out the window when zombies are trying to bite your face off.
Mm-hmm.
So this isn't really a political show, and we're not really interested in all that. But you're a medical student.
That's right.
And a blogger, and you've got a whole bunch of people who read your blog.
Right. So actually...
Yeah, it's kind of surprising, I have to say.
well,
I feel like I have nothing good to say, but people seem to enjoy it, so...
Yeah, well, it's so you started the blog in what, like 2010, middle of the year 2010. And right now, we're pretty much here to celebrate your 20,000th follower.
Yes.
That's psychosis. That's craziness.
Pretty psycho, yeah. It's pretty ridiculous when I think about it. Because I started off the blog with nobody reading for about 2 months. And then like the first blip showed up. I was like, oh, one guy. And now it's like almost 2 years later and there's 20,000 people. That's kind of a shocker for me.
Right. Well, it was funny because I went from day one to see like how, like when the transition happened. And you went from like 400 people to, I don't know, was it 3,000 in like the course of a week?
Yeah,
Maybe?
It was a crazy week. It was a crazy week that week.
Was it Dr. Cranky, like, I don't know.
Was he pimping you out?
Pimping you
Putting you on the street corner?
No. Actually, it was the same thing that happened this time. The thing that propelled me up to 20,000. It was the Tumblr radar.
okay.
One of my posts happened to get featured on the Tumblr radar.
That'll do
And it was a Grey's Anatomy picture of the neck anatomy. And that got featured and just bumped me up to 3,000 people overnight.
Who would have thought?
It was crazy. And then so like the same thing happened this time as well.
Gotcha. Very cool.
All right. So any of you guys that work at Tumblr, make sure you get Addie's daily blog featured there. Yeah, thanks.
So, on your blog, now we are ZombieTech, right? So, on your blog, one of your icons is a brain, right?
Yes.
And so then my question is, what is your favorite organ? Is it the brain or is it something else?
My favorite organ is not the brain because it's just a little bit too complicated for my taste. I think last year, when we were studying the brain, it was just too much to handle for 9 weeks. It was just 9 weeks of just brain. And, you know, I think I've had enough of the brain to last me a lifetime now. I think my most favorite organ is probably the eyes.
Wow.
That's just, yeah. I like the eyes. They're kind of simple, but they're so effective. They keep me in touch with the environment. And so that's kind of how I kind of perceive that organ.
Gotcha.
And yeah, that's probably my favorite one. The worst one, I think, is probably skin. I don't like skin lesions.
Ugh,
That's probably the worst one.
that's a good point. I don't know, man.
I don't know if I'd like
difficult.
studying the brain because it seems like a lot of
It's very complex.
what what they're teaching is still sort of up in the air to a great extent. Like they kind of know, but they're not sure, and it's still fairly new.
Yeah, there's more research going on for sure. I think a lot of the brain's been mapped out, and the the literature that we had to work with in our medical school was definitely too many pathways and too many things that you're never going to really use in a typical setting.
Yep. That's pretty much how I remember neurology,
Yeah.
neuroanatomy.
Who's going to go to a general practitioner to work on your brain, right? I mean, it's definitely specialists only sort of territory.
Mm-hmm.
Yeah, it's not every day you're going to just meet a brain surgeon, right? Like that's what the brain surgeons are for.
So, well, that's good. Well, I mean, kind of good, because then if you become a zombie, you won't go for the brain, you'll go for the eyes.
That's right.
Do you like grapes?
Sorry?
Do you like grapes?
Peeled grapes.
Peeled grapes.
Do I like grapes? I do like grapes.
It all connects together.
Yes, it's coming down together now.
Gotcha. Okay, well, good. At least brains are not your what is it? Menu of choice, or
You passed the zombie.
You passed
test.
the zombie test.
I passed the zombie test. Good.
Approve. So,
Does
with
not
your
accept brains when offered.
right. So, how did you end up deciding to blog your way through medical school?
I started blogging. Actually, I started blogging before medical school, even.
Okay.
I tried for a little bit with WordPress when I was in pharmacy school.
Mm-hmm.
And that didn't work out very well because I just didn't have the time or the energy to write long prose, which is what WordPress was kind of designed for at that time. And so I found that kind of frustrating. But I really wanted to have like a journal, something to document what I was doing through school, and just something I can look back on when I finished schooling and just see how much I've changed. That's essentially the main reason why I really want to blog. And didn't work out in pharmacy school. But when I got into medical school, I was like, you know what? I'm going to try this again. And that's when I found Tumblr and the microblogging, which was kind of more suitable to what I was interested in doing, which is just short, snappy little posts that I can just post in 5 minutes or 10 minutes. And so that's been kind of the way I've been posting ever since. And it's pretty much been a journey for me to kind of look at the very first post that I put up, and then looking at like the first week through medical school. And even now, like I'm only halfway through, but certainly I can see there's a change there. And that's kind of interesting for me to look at, because it's there, it's plain in front of me. And so that's been the most exciting part, I think, of this whole adventure.
Sure. Now, when you first started, what did you think that medical school would be like? And now you're in your third year, correct? Or finishing up your third year?
I'm just starting up my third year.
Okay, just starting your. So now starting your third year, what's changed in terms of like your expectations for medical school?
I think my expectations haven't really changed that much. I think like before I got into medical school, I had the impression that medical school was going to be hard. For sure, it's been hard. I think it's actually reinforced the perception that it's hard, because like once you're in medical school, you realized how wrong you were to think like you were just gonna breeze through it. Like, oh yeah, I breezed through everything else in high school and my undergrad. Like it's gonna be no, it's not easy.
It just gets even harder.
It gets worse. Yeah,
Right.
It gets harder. And
Right.
so like I think it's only reinforced everything that I kind of already knew before I got into medical school.
Sure.
And there's some differences. There are things that kind of are different than what I imagined. Certainly the clinical aspect is different. I think there's a lot more waiting around than I would imagine than before. a lot of waiting for lab tests, lab results, and that's been kind of different. But otherwise, I think everything else has been pretty consistent.
Mm-hmm. Now, do you ever look back through your blog and think about what you would tell your former self, or
My
like
self?
Yeah, like now looking back at the guy who wrote post number 1.
Post number 1, yeah. I would say if I could jump back in time and tell my former self, I would tell him to think very carefully about what he does. I think when I got into medical school, there was a lot of naivety about what it means to be a medical student and what it means to be a doctor. I think seeing patients and seeing how doctors operate has given me like something more than I imagined, in terms of like the experiences, the emotional experiences. I think like I knew it was going to be emotional. There's going to be some emotions being thrown around, but I think seeing patients at their worst and seeing patients at their best, I think it's definitely a little bit stressful on the personal side, and certainly outside of medical school, it's been very stressful as well to keep a balance in the personal life. And so I think I would just tell them to like really think carefully about what you're going to do, and how you're going to do it, because I think in the last 2.5 years, I would say there's been some missteps. I would say, like in terms of how I handled certain things, and yeah, that's probably the main thing I would tell my former self.
Now you say mishandled a few things. Is that like all over, like both in clinicals, studying, and outside of life, or outside of school life, I should say? Or has it been kind of something that keeps coming to bite you?
Not so much keeps coming back to bite me. I think it's more like the managing the balance and managing the time. That's been where the missteps happen. I think it's really easy to get sucked into medical school. There's kind of a culture within medicine where it's kind of, the dedication to your craft is still kind of a very paramount thing within medicine. And so they expect a lot from you, and you certainly expect a lot from yourself. And so when you have that sort of pressure there, it's easy to kind of lose sight of what is important in your life.
Sure.
So I think that's probably like the main missteps. Like sometimes like you just kind of lose your perspective on things, and so that's kind of where it stems from.
Sure. Now I remember because I'm a bio major, as well as a nurse, and I remember when I was doing my bio major, I had considered doing pre-med classes, but I remember how ridiculously competitive they were in college. So then I'm a very laid back person. I'm like, well, I mean, I like to do my best, but I'm not gonna step on somebody else to do it, now that you're in medical school, does it pay to be as competitive? I mean, it pays obviously to know your craft and to study properly, but does it pay to be number one, to get the highest score in the class, to be teacher's pet, etc.?
I personally don't think it really matters once you are in medical school. I mean, it's nice, I guess, at the very end of the day if you can get that H on your report saying like, yeah, you passed with honors and you're the top 5% of your class. But at the end of the day, when you graduate, it really doesn't mean a whole lot. I think when you're actually applying for a residency or for a job, once you are past that first hurdle of getting into medical school, we're all kind of on equal footing here. And I think medical school does a good job of trying to level the playing field. We don't use percentages on our grading.
Okay.
So actually, when you get a report at the very end of the year, what people see, you see your own percentages certainly for all your classes, but when you actually have those marks submitted outside of school, or people look at your marks from outside of school, they just see either you have an honors, you passed, or you failed.
Yeah.
Right. So for the majority of people, they're just going to have a pass. Right. So there's really no differentiator here, because the idea here would be that when you graduate from medical school, that everyone should have had the exact same amount of training. And certainly people are not going to be great at everything, but it's just to give everybody the same type of opportunities here. I think that, having highly competitive people in your class who are trying to, thwart you at every turn is not really going to help in a collaborative environment. So I think having those sort of things put in place is something to help reduce the level of competitiveness. But certainly there are always people who are going to be like that. I mean, you can't change that.
Right.
Yeah.
Right. And it's funny because I think back to some of the folks who I know, and I think I've heard this said somewhere where, it doesn't matter if you're the top of your class or the bottom of your class, you're still going to get an MD.
Yeah.
So regardless of where, I mean, obviously you want, at the end of the day, you want to have the knowledge that you need in order to take care of your patients, but that doesn't require getting 100% on everything.
Absolutely.
So,
yes.
Interesting.
So I mean, you can't expect everyone to be perfect at neurology and perfect at dermatology and perfect at cardiovascular systems.
Yes.
And someone's going to be good at something, and they're going to naturally gravitate to their interest.
Right.
And so at the very end, it's not going to be the mark that you get in school that's going to set you apart. It's your clinical experience and what you learn within a clinic. Because I think everyone would probably agree, I think, in my class, that they learn a lot better doing it in the clinical experience than doing it in an academic setting.
And I know some of your followers will be listening and might ask the following question, which is, do you notice whether or not those who get better grades tend to be, quote, better doctors? Is there a correlation that you've seen?
Ooh, that's a good question. I don't know, actually. I think they have a better theoretical background, I guess you would call it, just because they understand the concepts better. But does it translate well into a clinical setting? I think it would almost be the same kind of argument as book smart versus street smart. I mean, you could potentially be book smart and also street smart, but it doesn't necessarily translate that well.
Right.
I certainly know one of my classmates. She did very, very well in class, but you forget things if you don't use it. And certainly when I asked her about concepts she obviously was very familiar with, 3-4 months ago, she also had a difficult time with it. So does the mark really translate all that well competitively? I really don't know, actually.
Right.
But my intuition would say that no, it doesn't really translate directly like that.
Fair enough. And also, then I have to, because this is ZombieTech, I have to ask, would you prefer that you had a street smart doctor or a book smart doctor in the zombie apocalypse?
Street smart doctor or
Hex? Yeah.
I would probably go with the street smart doctor if I got bit.
If you got bit, you're screwed.
If I got bit, I want him to amputate that arm.
You think that?
Very quickly.
Very quickly, as opposed to the book smart doctor who's who got the MD PhD doing research in a lab. Let's do a blood sample and see what you got. No, I don't want that guy. I want the guy who knows what he's doing. And he's gonna chop that arm off.
So basically, a ship's doctor.
Oh yeah.
Oh my gosh, that sounds horrible. Okay, all right. Well, I concur. Because from my experience, the book smart doctors don't know how to talk to the patients.
And
But I don't know. I mean, that's obviously a gross stereotype. So right now you are currently okay. So you're in your third year, starting your third year.
Yes.
And you've been going through a whole bunch of different rotations. Can you tell us which rotations you've been through, and also kind of the best and the worst of these rotations, like what you felt were the best and the worst of these rotations?
I actually have not yet started my rotation. So the way things work in my school is the first 2 years are academic. I think for most schools it's kind of like it's first 2 years are academic, and the third year is when you start getting the rotations, which is true. But our third year actually begins with a rural rotation. So
it's your first one, and
yeah. So
okay.
my first one, I'm currently doing my first one, and so it's really just been a rural rotation, which is to offer a different perspective. I think most, if not all, medical schools are established in larger urban centers. And that gives you, not to say infinite amount of resources, but certainly a lot more resources than what would be available in a rural setting. And so everybody has to do a rural rotation to get a feel for what it would be like if you did not have all those resources.
So like in a zombie apocalypse, right?
Yeah, so kind of like in a zombie apocalypse. So all the doctors would have to take on more roles in a rural setting, and people would have to make do with the things that they have, such as no MRI or no CT, which means you have to rely more on clinical experience and physical exams and so forth. So there's differences in the way rural practice is set up. And so that's kind of what I'm going through right now. And it's definitely different. It's different from working in a large city center. I mean, the doctors, every single doctor is way more knowledgeable, I think, because they have to take on so many more roles. And so by far, I think I only have one to compare to, so it's pretty much my best one, right? It's so far it's my best experience in medical school.
Awesome. At least you know it's not your worst.
Well, it's also that at the moment.
Well,
he's on the first one, so.
Yeah, but see, I mean, like for instance, my first clinical rotation was in liver and kidney transplants. That was worst. I mean, I'd even have to have a best to know that would be the worst one.
Right, okay.
Do you see what I mean?
Yeah.
So it is possible to have a best without a worst.
I was just making a Boolean joke, but okay.
Yeah, I know. You computer nerd, you. I get it. Okay, so then, but you've done clinical well, not rotations, I guess. Maybe that's the wrong word. But you've had clinical experience before in your first 2 years, right?
Yes, I have. So those are more following the family doctor.
Oh, okay.
And so the family doctor, he's the guy you see when you get sick, you have a cold. So really, that's kind of to get you introduced to the concept of working with doctors and seeing what a family doctor does when he's not just seeing you. Like you want to see how he works with everybody. And so we've had that experience for sure for the last 2 years. But this one is the first introduction to specialists. This is the rural community that has only a few specialists or specialists who have to fly in from larger urban centers to kind of, see patients once a month and just jam pack everything in there. It's crazy. But you learn a lot in this type of environment too.
So up there, you guys fly the doctors around, not the patients?
Yeah, so they get the VIP treatment around here. Just because sometimes it's hard for patients to move around. They might have difficulties being transported or for any other number of reasons. So there are definitely patients who get referred out to the larger centers just because we lack the equipment or the specialists are down in a larger urban center, but there are also specialists who come by as well, just to check up on the patients.
That's pretty cool.
I think it'd be extremely interesting living in a place where if you got a cold, you could go to a doctor as a small business owner in the United States, none of us can actually afford insurance. So the only way you can go to the doctor is if you work for, some big company.
Mm-hmm.
Right.
Or are absolutely poor and, they just give it to you anyway. But I've never been to the doctor for a cold or anything like that in my life. The only way to get me into a doctor is if I have some sort of a serious injury.
If I hit him upside the head and drag him in.
Right. Right. Yeah. So I can't say I'm very familiar with the American system, but certainly here, with, I guess, universal healthcare, it definitely allows patients to come in for a variety of reasons. And sometimes, things don't necessarily have to be super serious. But sometimes, you still have patients who come in with serious injuries who come in.
Mm-hmm. I think it's sort of there's a plus side and a downside to both of the systems, but because I can't go to the doctor for little things, I think I take a great deal better care of myself than somebody who could just run to the doctor anytime. I just simply don't do things that would hurt me. You know what I mean? Because I know I can't afford to pay for it if I screw up and like cut my finger off or something like that. So I'm gonna be extremely careful with the bandsaw.
Suck it up, grow up here.
Right.
I'm not gonna get a really bad flu if I can help it.
I think one of the things I've noticed, at least here, it's definitely a more striking example in the rural center, is that there's a better continuity of care with patients, just because even if it's a minor thing like a cold or so forth, like you get to know your patients a little bit better. Like you can see people more often, you can ask about how they're doing with their management and so forth, their diabetes or their hypertension. And so there's a lot more, chronic management, and better patient-doctor relationships in this type of system.
And their baseline too, so like what's expected and what's odd about how they look.
Yes.
In a given time, which is very useful.
And it's like cool that they can walk up to you at the diner and say, "Hey, doc, I see you're eating a red meat burger there. Is that okay to eat for me? Looks tasty."
True.
I mean, sometimes you also want to have a little bit of your privacy too. So
right.
It's a double-edged sword.
Right.
So you're doing your rural stuff right now. What's next? Do you know yet?
Next up, I get a break for a little bit, but then afterwards I start what's called an integrated clerkship. So my program is slightly different. So I get to do an integrated clerkship through medicine. So instead of doing the classical, small block rotations of internal medicine or surgery and so forth, I do it all at the same time. And that's kind of hard to explain, but I did make a post about it before on my blog that kind of helped explain it a little bit more. But essentially, you're following a lot of doctors at once, and you kind of have a different schedule every single day.
Wow.
Yeah.
That's a lot to keep in your mind.
Yeah, so it's definitely different, and the learning curve is definitely on a longer time scale. It's on a longer time scale than on a regular block.
Sure.
But I think at the very end of the day, like you're gonna be you're gonna be a better doctor. I think.
Right. I agree with that. Well, good luck on that. I don't think I would be able to do that. It sounds like floating to a nurse.
I think putting future doctors through as much painful, complicated crap as possible is usually a good idea. I mean, you want to push them, but not break them.
Right.
Fair enough.
Build character so that when it's time to actually, help people.
That's right.
Yeah.
So, let's go through your years, your 3 years. Well, 2.5 or 2 and some change.
Yeah, 2 and some change. Yeah.
2 and some change. What's the best and the worst of each of those years?
Best and the worst of each of those years.
Mm-hmm.
First year. I would say the best thing out of first year was probably going into the lab, the anatomy lab, the very first. I think that was probably the most interesting thing for me.
With your cadaver.
With the cadavers, yes. I think there's something to be said about that. It's cool to me in an anatomical way. I've always been more of a hands-on sort of learner, and so working with something I'm already interested in, which is anatomy and structure, on an actual cadaver was kind of a very exhilarating experience. But at the same time, it was really humbling.
Not in the get set up and bit your face exhilaration. More in the you got to learn something.
Yes, I got to learn.
So that's a different kind of corpse exhilaration than we usually have on the show.
Right.
But it definitely was also humbling too, because it's like a side of medicine you don't really. I mean, people think about it, but they don't talk about it that much. It's not like people will talk about like the crazy things that they saw in the clinic, but like this is a kind of the forgotten gem of medical school, which is like people who were kind enough to donate their bodies for your education. And I think that in a way was kind of like a very humbling experience to me. So that I think was definitely one of the highlights for first year. The worst part of first year was, gosh, I don't know, actually. I think the worst part of first year is probably just doing the whole relationship thing for me, because I was already in a relationship, and I think this was like my first kind of foray into long distance relationships, and so that was a challenge, and it continues to be kind of a challenge for sure. But I think at that time, like the shock of it was definitely not pleasant.
Sure.
Yeah, second year, I think like a lot of the things were kind of the same. Like you still did labs and so forth, and so that kind of like has transitioned off. It's kind of like the baseline now. Second year, the best part was going into the specialty for the first time. We have kind of, I guess, minor electives that you're able to take, and I got to go into the surgery ward for the very first time and actually do that. That was very exciting.
Very cool.
And then the worst part was exam time. Worst thing.
Yeah.
Sounds by far the second year exams or the second year material in general was much more difficult. So the exam period was by far the most stressful thing I think I've had to go through in a while. Cortisol levels were through the roof, killing brain cells.
Nerd joke.
Gotcha. Now, you mentioned surgery, and you also mentioned the exhilaration of anatomy. And I know that I think throughout the past 3 years, you've mentioned time and time after again on your blog that it's either internal medicine or surgery. Yes. Now, having gone through all your clinical rotations, are you still divided between those two, or are you thinking something completely different?
I think those are still like my top two choices. I'm definitely still open to everything. I think at the moment, it's everything is so fresh and everything is so exciting. I think it'd be really kind of short-sighted to try and
pinhole yourself yet.
Yeah, to pigeonhole myself into just focusing on those two things. I think that a lot of things could probably be applicable. I definitely know I can't do pathology. I think that's out of the ball for me. Not because I don't like it, but I think like I don't react well to formaldehyde. I don't like the smell. I can't stand the smell. So
there's some talk about the munchies.
Yeah, the munchies. Yeah, definitely. I don't like being hungry all the time. So I prefer, to feel full and, actually, not eat all the time and
so
beast or something.
All right, you guys are going to have to fill
for those
fill
who don't
and I think I'm representing a lot of the audience here who's not getting the exact reference.
I was just
formaldehyde and munchies shouldn't ever be in the same sentence.
They are apparently. So this was a blog post that I read on his lovely blog, and I guess some tutor told you guys that it's normal to get the munchies after dealing with the cadavers and formaldehyde, because formaldehyde and like all those other preservatives can give you the munchies. Yeah.
This is the sort of stuff that
Isn't
you
that the
just
funniest
don't
thing?
want to know about. I mean,
It
wow.
definitely gives you, something to think about. I think everyone was having like, like an identity crisis. I think everyone's coming out thinking like, I get hungry when I'm in the lab and I'm dissecting, some muscles out, and then
Brains.
like brain, and like you think that you're turning into some monster like through the lab. And I think like the tutor caught wind that like people were getting anxious, and so he just laid it out there. He was like, "Don't worry, everybody feels that. You just get the munchies."
That is super funny. It explains a few things, but that is super funny.
I know watching zombie movies sometimes I'll
Twinkies.
say to Addie, man, this movie's making me hungry. But that's mostly just to like creep her out. I mean, I don't think there was
It's actually
any
kind of weird.
physiological reason for it.
Do you watch Bones? Have you ever watched Bones?
I don't watch Bones. I don't watch TV, actually. I don't
He
have
doesn't
a
have
TV.
time.
I don't have time.
Man,
Medical
Bones has
student.
like the most grotesque like crime scenes, where they look through bones and just grossness. And we are always eating when we're watching Bones. And like every time, we don't even think about it. We're just sitting there watching. I'm like, wait a minute. I have a bowl of food in my hand. We're kind of weird.
Are you eating popcorn? Please don't tell me it's anything like different than popcorn.
Oh yeah, like goulash. That's
Yeah.
a great one for watching Bones too, because it's all like meaty and
Oh.
red and yeah,
Exactly.
yummy.
It's very strange. Very strange. But yeah. So I think Whisker, he's a bit stronger in the stomach than he thinks.
Yeah, well, I don't know if I would manage to get out of a lab session with a cadaver without getting the munchies. I don't know. I don't know which way I'd swing on that.
What do you mean?
I would either leave my lunch there or get the munchies just like everyone else. I don't know which,
Gross.
and I
No,
don't think I
no,
want to find
yeah,
out.
No, we're good.
I think I'll leave that to the doctor types.
Yeah, we're good. So,
Okay.
question. Yes,
Yeah.
we will keep moving on. So all these books and all this crazy studying, how do you end up do you have tips for people to move from book learning to actual human practice?
Yeah. Just do it.
Just do it.
Just do it. I think someone asked me that question before. I didn't actually get a chance to, make it a public answer.
Mm-hmm.
But I think that's definitely one of the more challenging parts of the transition from second year to third year.
Mhm.
I think that you can learn. That's where the whole book smart versus street smart translation comes from too. You can learn a lot of things, and you can learn how to put in an IV line, and you can learn all these things. But like when it actually comes time to do it, like there's nothing better than just having the experience of doing it,
Mhm.
right? You're always going to have that first time where you're just not sure what you're doing, and you're not certain about if you're doing things right, if you're missing things, and it really just comes with practice, right?
Sure.
So yeah, there's really nothing more than just diving in there and just getting your hands dirty.
And this, of course, applies to so many things in life. Studying only ever gets you so far.
Yeah.
At some point, you just need to apply what you've learned to the real world because the human brain really does work that way. A lot of people say they learn better by doing. It's because, the human itself evolved to be good at learning that way. This whole book learning stuff is sort of new.
For the birds?
No, it's not for the birds, but it's kind of new because it's also disconnected from the real world. It's easier for most people to learn that way. So, like I said, you can apply this to anything. Be it medicine or DIY projects. At some point, you just got to stop reading about it and get
Just
your
do
hands
it.
dirty, as it were.
Sure.
Mm-hmm.
Have you had to learn how to talk at the patient's level? Like, have you had to reel yourself back from saying, "Ah, yes, well, your stenosis seems to be, blah blah blah," and they're just like, "Yeah,
Oh yeah,
what?"
yeah. I've had to do that a few times. I think the worst are when you talk to someone whose English is not their first or their primary language,
Sure.
and so they're already at a disadvantage because they don't understand the word. They probably don't even know what you're saying. They're just like, it's just gibberish to them, right?
Right.
And so that type of patient population definitely had issues with figuring out what the right words are.
Mm-hmm.
The other one is children.
Yeah.
I've had very little or limited success with children. It's just like you can either talk way too smart or you can talk way below their level, and then they think that you're just mocking them, right? I caught myself a few times being like, oh, like how, like, is that thing owie? And it's like, you mean, does that hurt? It's just like, yeah, like, does it hurt? Yeah, you have to, like, I think it comes with experience. Like, you just kind of like know
Right.
at some point, like, what type of language level that they're gonna be at.
Right.
Annie has called me a few times from work when she gets her assignment as a nurse, and she'll be
my
like,
gosh.
"Okay, this patient is like 6. Now, is 6 like? Do I need to talk like baby talk, or do they get it?" I'm like, okay.
Yeah, I think children are by far the most challenging for me.
Sure.
For that type of jargon, the medical jargon is definitely something you have to work around.
Right. Now, how about other doctors? Like, have you had to take care of other doctors or med students, and do you treat them any differently?
Like as a patient?
Mm-hmm. Yep.
I haven't treated any doctors in the clinic. Like my preceptor certainly has not really treated any doctors while I'm there.
Mm-hmm.
I'm sure, like at least in a smaller community like the one I'm in right now, like you're bound to have a doctor who's gonna like treat another doctor. I think that they do treat each other slightly differently just because they know the knowledge level is there already.
Mm-hmm.
And certainly like a doctor, like ethically and professionally, like they can't treat themselves.
Right.
So even if they had something that they obviously know is like, oh, I have stomach ulcers, or I have gastric reflux,
Mm-hmm.
they still have to see another doctor.
Mm-hmm.
And so I think there's a comfort level there knowing that like this person knows the medical jargon I'm going to throw at him, and he probably already knows what the diagnosis is. But you still have to go through that sort of process, right? And so I think there is some differences in terms of how you operate with them, and certainly like with other medical professionals that I've had to treat. Like I've treated some paramedics and nurses, and like they kind of know the lingo, they kind of know what's going on as well, and so like you don't have to spend as much time trying to explain why things are happening or why you're doing this because they already have an idea.
Mm-hmm. So
I spend a lot of time with a nurse, and I think treating one would probably just be a pain.
Hey, back up off this. So then, like, would you want to tell your doctor that you're a med student? Like, do you think that would get you better care, or would you prefer that they explain it to you in layman's terms?
I have had the experience of telling my doctor that I am a medical student.
Mm-hmm.
And certainly they do change the way they speak to you. I think. I think a lot of my friends have noticed the same thing as well, which is like once they realize that you're part of the healthcare profession and you know how the system works and that you're eventually going to be part of the system and working with them, I think at some subconscious level there is a change there. And
so
like
it's not like sticking a student driver light on the top of your car. They don't like go, oh crap, you're a student, and then run away.
No, they don't know, not at all. I think at a subconscious level everyone's going to treat a coworker or a future coworker a little bit differently.
Mm-hmm.
I think we can't help that. That's just part of human nature.
Mm-hmm.
I don't think they mean to do that, but certainly when I was seeing my own doctor for, something very minor, but like I still was like, oh yeah, like um, I'm a medical student, and like, can you just kind of explain or go through kind of like the reasoning here? Like, I just want to learn something at that point. Actually,
Mm-hmm.
I was trying to learn something about the process he was doing, and then like his tone would change, and he would try to explain it a little bit at a higher level, and he was more open to trying things that perhaps he wasn't open to before, because I was quizzing him at that point. I was putting him on the spot in a way, right? Because now this is someone who kind of knows a little bit more.
Right.
So like you have to treat them with like things that like make sense
Right.
a little more to like them, right? So
You
like,
can't
oh
just
yeah,
you can't just they can't like write you off as
yeah, they can't
oh
write,
right.
right? Like I mean, like I think, oh gosh, I hope I'm not giving anything away here. Um, but I think, for example, I think if a patient came to you and they had a complaint and they didn't really have any good basis for the complaint, it was more kind of in their head.
Mm-hmm.
They believed something was happening, but really there was no.
Hypochondriac.
Yeah, kind of like that. You might just be like, here, I'm going to give you this, and it turns out it's a placebo, but they don't know that, and they feel better, right?
Right.
But even in that sort of circumstance, like there was a change there, because like, okay, so they come in a few times, and it's always never something serious. I mean, there's always going to be like a slight bias.
Mm-hmm.
I
Mm-hmm.
don't know if that makes sense, but
Yep.
I feel there's a bias.
Sure.
Even if it's like very slight, it's always going to be there.
Sure. Sure. Okay.
So if you want really good treatment, folks, make sure you try to convince your doctor that nothing's wrong with me. And then they'll never have that bias.
Now it is wrong.
Unless, you're like on the floor convulsing, in which case.
I would probably still be stubborn enough to say, nothing's wrong.
Yeah. That's when I whack you upside the head again and drag you into the doctor's.
Sigh.
So, gonna change gears a little bit here, and kind of focus on your blogging aspect.
Sure.
So I've noticed that, I guess, as your blog went up in popularity, a lot of people, I think, would start asking you questions about their own health, much like how they asked Dr. Cranky. And then you would follow up most of their questions with saying, essentially, I am legally and ethically bound not to provide counsel. And if you require actual medical attention or consultation, contact your personal physician. What kind of risk do you see with your blog now that it is so popular?
Yeah, I wrestle with that every single day. Is kind of that fine line of how far can you go and how much can you say. I know, like at the student level, at least, I really can't give any advice. There's too much at risk, right? You don't know because you don't have the clinical experience. So if you try to give, or if someone asks for medical advice and you give it, and that's just based on something you read. And again, this doesn't apply to the years of experience an actual doctor has working in a real life setting. Just basing your advice off of something you read or something you noticed in passing, it could put somebody at risk for some serious complications, because they might miss something. I think one of the examples they gave in class was that somebody, and it was a doctor too, it was not even a medical student, it was a doctor who was neighbors with the patient, and the patient came by on a barbecue, just like across the fence, asking like, oh, I have this thing, and is there anything wrong? And the doctor said, no, I think it's fine. And it's not in a clinical setting where you have your stethoscope and you have you don't have the environment required to accurately and properly assess a patient to give the sort of advice. Right. And that patient ended up having some heart troubles. It turned out to be like heart troubles that the doctor did not know about. I mean, like that's the type of risk you run. I think at my level, I'm not very comfortable giving any sort of advice, even if I'm going to be out of med school and have my MD. I think at this point I'm still not at that level yet. I'm
Mm-hmm.
sure like one day, yes, I'll be able to, think a little bit, on based on clinical experience and be like, yes, I can give you some good advice. But at this point, not comfortable, and even in the legal setting, not even possible. So
Mm.
the risk to the license, my future license, I think, yeah, there's still some risk there.
Okay.
Just because you've sworn, the Hippocratic Oath, and everyone's had to do that. And I think that if you do give the advice, I mean, there's always a caveat. I mean, there are things that you could probably look at and be like, this is probably not a big deal.
Mm-hmm.
Like after you already graduate and you have the clinical experience, you could probably look at someone down the street and say like, hey, like, can you tell me what's wrong? And you could probably give some advice. But I think the caveat at the very end of it is still, you have to tell the patient that they have to see their doctor and get
Mm-hmm.
properly assessed.
Mm-hmm.
Because you can't properly assess someone just walking off the street. It's just not it's not the best way to do it, and you lack the equipment necessary to do it.
Sure.
So it sounds to me like your blog is going to remain directly tied to your personal experiences and observations of the world as we see it.
Yes.
Yep. Now, can you believe it? We have like less than 10 minutes left.
Mhm.
So I did, because it is your 20,000th follower celebration, I did want to let you field some of the questions that your followers have asked.
Sure.
So we'll start with the ones I think that were on the post itself and go from there.
Sure. I haven't read them yet, so you can just lay it on me.
Perfect. Okay. So Kyle asks, will your skills as a doctor still be useful without all the technology in a zombie apocalypse?
Without all the technology, yeah, I think a lot of it can translate well without the technology. I mean, that's the benefit of having so much of your education grounded in a classical setting.
Mm-hmm.
I mean, we still have to learn signs and symptoms of when a patient comes in with an abdominal pain, like all the different things that it could be, all the different signs that are out there. You still have to learn how to do a physical exam. And these are skills that have been passed down for hundreds and hundreds of years. Like people have found these things to, be true.
Mm-hmm.
And they are still useful in a clinical setting. I mean, you can listen to the heart and probably figure out that there's a heart problem, right? And you can do a shoulder exam and figure out like there's a problem with so and so muscle. I mean, those are still practical skills, and you don't necessarily need an MRI or CT to operate as a doctor.
Mm-hmm.
I mean, these are recent inventions of like the last 100 years, and doctors in the past certainly had more limited, access to equipment, but they still managed to do some pretty amazing stuff. So I think, yeah.
Cool. And Ramani Rain asks, from a medical standpoint, would it be possible for a zombie to actually be dead, no breathing, heartbeat, etc., but still move around? Or would it have to be an infection or a parasite?
Oh dear. I think zombies, well, they're dead, but they're not dead. I mean, like, I think that they probably can't move around. I think that's the bottom line. As it is, being dead, no breathing, heartbeat. I think they wouldn't be able to move around. I mean, there's a lot of biochemistry that I obviously don't really remember very well, but
the muscles need the blood flowing to be able to do their thing.
Your blood's gonna clot. I mean, that's what rigor mortis is. Rigor mortis is when you've passed away for a couple of hours. I think it's like 7 or 8 hours. Your body is rigid because all the muscles have lost the energy capacity to move, and the electrolyte balance is off in your body, and your blood has clotted. I mean, there's a lot of things that are working against the zombie to move.
Fair enough.
And so I think it would have to be an infection or a parasite.
Okay. Gotcha. And then Dr. Cranky asks, according to canon, zombies lust after the brains of the living, above all other organs. However, based on your experience with neuroanatomy labs, and given the typical zombie's poor motor skills and inability to use a Stryker autopsy bone saw, isn't the brain too difficult for zombies to access?
Now, do I need to put a voice disguiser on that question?
No, not that one.
Oh, Cranky just laid it all on me, eh? Okay.
He does that.
Yeah, always ask the hard ball questions. Yeah, I think the brain is too hard to access. I mean,
Ooh.
you were born with these chompers, and I don't care how powerful your chompers are. Like your teeth are, they're not really designed for this type of smooth, hard surface like a skull.
That's a good point.
I think I don't think we need to really talk about the outbreak of quote unquote zombie attacks that are just rampant in Miami and everywhere else it seems.
Oh,
But I mean, like
goodness.
even without getting access to the brain, I think you'd have you can obviously do a lot of damage. I think that person, very unfortunate victim. I think like he's shown that you can still get pretty significant damage even
Just teeth.
with just teeth. But getting
Yeah.
to the brain, yeah, probably not.
Gotcha. Okay. Let it be heard. Medical state has stated that zombies cannot easily get to the brains.
Oh, they'll have to dig for it. Real,
Oh, awkward.
very, very, very awkward.
Awkward. Okay. And then the last fan question from Fitness Dump. Can you maintain an active lifestyle even when studying medicine? Or any exercise, actually, like running or kickboxing or the like? I'm going to enter med school next year, and I want to keep the mix of academics and exercise I've been doing during my pre-med.
Fitness dump. Okay, well, I would say, yeah, you can maintain a pretty active lifestyle. I think this comes back to time management and just knowing how to manage your time and balancing your life. Um, the ideal is you don't want to have med school suck up your whole life. I mean, that's just going to throw everything off. You're going to burn yourself out. And sustaining an active lifestyle, I think, is totally doable. You just need to know how much you can do in a day. I think right now I'm doing maybe like an hour every other day. I mean,
That's pretty good.
you can always dedicate time. You can set aside time. There's always time to do things that you need to do. Like you obviously still need to eat, you still need to sleep, you need to do all these things. And then if you plan your day well enough, you can say, listen, I'm going to do one thing today. I'm just going to study osteoporosis, and that's it. I'm just going to study that very, very well, do that, and then I'm going to spend the rest of my time doing whatever I like. I think that is the approach that you have to do when you're in medical school, is that you have to know how to divvy up your time accordingly.
Mm-hmm.
And so active lifestyle, not a problem. You just need to know I think people come in not knowing how to do it. I think it's really hard when it's in medical school. But you figure it out. You figure out how to manage your time and what works best for you to study and to pursue the things you like. I mean, blogging in my case is something I dedicate maybe 30 minutes to an hour of my time just reading through some stuff and posting, and that's fine with me. And then every other day I'll go and do some exercise. I mean, you just need to know how to get it done.
Right.
And of course, there's simple things in modern day life like don't own a TV and turn your cell phone off at the door. You know, those sorts of things will give you 10 times as much free time.
Right.
Oh yeah. When you're not, busy looking at Facebook and all those things. I mean, you can build up a lot of free time just by cutting things away, for sure.
Right. Okay, so now that we have gotten all of the side questions answered, we have our 2 actual ZombieTech questions that we ask all of our guests. First, what 3 tools would you bring to a zombie apocalypse bunker?
3 tools I would bring. Oh man. I Oh, jeez. I want my bone saw.
Okay, bone saw. Just in
Bone
case you become
saw.
a zombie.
Is that for
Just,
work or
just
pleasure?
actually no, not a bone saw. Bone saw is actually they have a hard time cutting through some things. I just want like a good old fashioned like woodworking saw. I don't even know. Uh,
Just a
just a
nice
good I
just a
just
nice Stanley saw for chopping off limbs and or trees.
yes, yes. I'm just going. I think I'm gonna just go with weapons here. All of them. All of them are weapons.
All
Just gonna
three
be armed to the
weapons.
teeth.
Armed to the teeth. This is like the doctor who means serious business here. Oh no, I can't. I'm gonna bring. I need epinephrine. I need EpiPens. Lots of them.
Whoa,
That's a new one.
that's a new one. Why do you need a lot of EpiPens?
I need to be able to run away as fast as I can. I need the
So
adrenaline.
it's for your own personal use then.
It's for
Your little jolt of, oh yeah, good
I
go.
need the epinephrine for, superhuman strength when I need it. That's what it's going to be about.
And hopefully this doesn't end like the PCP ended in Miami.
Uh,
So just,
Oh, man.
hit
Bath
yourself with the
salts.
EpiPen, but run away from people.
Yes, yes, yes.
Okay,
No, EpiPens, I think, would be nice. I mean, like,
that'd be
if
super
you,
cool.
yeah, I think it would be pretty useful. And then last, yeah, I'd probably go with another weapon. I'll go with a baseball bat. Why not? It's
Okay.
a classic.
Yep,
It's
yep,
a
yep.
classic weapon.
Very cool. Okay, so then we got the
Are you
wood
gonna have
saw.
a hard time getting into like a group of people with those items? Because I mean, if I'm like wandering around trying to survive a zombie apocalypse, and you show up and you're like, "Yeah, I'm a medical student, so I'm really useful," but I notice that you're carrying a saw, a bat, and a bag full of EpiPens. I'm gonna be like,
Well, if I had my way, I would have like, a doctor's bag. I think that's cheating though.
That'd be acceptable.
Okay, is that acceptable? Okay,
Yeah,
I'll
that's
bring,
acceptable.
I'll bring a doctor's bag with, some medical equipment that I can use.
I think that we've all seen enough zombie movies to know that all medical students in zombie movies automatically get a little house call bag.
Yep.
Yeah, okay, fantastic. Yeah, okay.
Yeah, it's
Okay. I'll get I'll get my medical bag then.
Awesome.
It's a bag of EpiPens. Any day.
That's
day.
awesome.
all right. And the last question, which really says a lot about a man. What book? If you can only bring one book, because you can only carry it, you're out the door, and you have to rebuild civilization. What book do you think would be the most important one to bring with you?
Ask the one man who does not like to read books. Oh man, the one book. Oh, jeez. You stumped me here.
It seems like something like Grey's Anatomy would be a good choice.
On a zombie apocalypse, you're gonna have so many. You don't need more examples. You don't need more examples of bodies.
You've got plenty of bodies to play with there to figure it out again.
I don't want to.
Okay.
I don't want to touch them though. They're infected. You don't want to get infected.
Yeah, there's not enough rubber gloves in the zombie apocalypse.
No, never enough. I'll go with a personal favorite. It's definitely not. It's kind of more obscure, but I enjoyed it. It's the One Day in the Life of Ivan Nosovich. It was written by Solzhenitsyn. It's a short book, but it talks all about surviving in the Gulag during
Interesting.
Soviet Russia. And it's all about it's one day. It's just one day in his life in a Gulag. I think like that resonates in some way with the whole rebuilding civilization after a zombie apocalypse.
We actually have a friend in Latvia, and I asked him once, so what was it like when the Soviet Union collapsed and you guys became your own country? He's like, well, a couple years before that, I moved out into the country to work on a house for someone, and it took us several years to finish it. So when I got back, I found out we were our own country. It's like, wow, that's awesome.
Well played. Well played.
That is pretty cool.
We kind of just missed the whole thing there. Okay. Fair
All
enough.
right. So excellent show, guys. Very, very enjoyable. Thank you for joining us this week, Tom.
Thank you very much
Yep.
for having me.
And are there any websites, of course, that you'd like to, I guess, to let everybody know about?
No, I don't think there's really anything that comes to mind right now. I mean, if you're interested in a medical perspective from a medical student, by all means, you can check out my stuff. But otherwise, I'm open to anything. So I'm not gonna, plug anybody's website. Definitely not gonna plug my own.
Okay, so we'll
do it for you. So you can find Tom's blog on medicalstate.tumblr.com, and you can also find him on Twitter at medicalstate.
Yeah.
Yep.
And you guys can find this show every Thursday at ZombieTech.tv. We're, of course, on Twitter at tymkrs.com as well. And we put links to all of our stuff up there. This isn't the only show we do, obviously. So that's it for this week. Thank you for listening, everyone. And we'll be back next week with another edition of Zombie Tech.
Correcto. Till then.
Bye.
Bye.
Bye.